If you've been struggling with fatigue, irregular cycles, unexplained weight gain, and fertility challenges, PCOS might not be the only thing going on. Your thyroid could be playing a much bigger role than you think. In this video, you'll learn how PCOS and thyroid issues are deeply connected, the root causes that often get missed in both conditions, key nutrients that support your thyroid and hormone health, and what you can do today to start feeling better and support your fertility journey. And if you're just getting started, I've created a free PCOS pregnancy prep guide that walks you through the steps I use with clients to help regulate their cycles and support thyroid health naturally. Watch till the end to find out how you can gain access to it. Did you know that if you have PCOS, you're more likely to also have thyroid issues, especially a condition called Hashimoto's thyroiditis? These two conditions often overlap, and they both affect your metabolism, your menstrual cycles, energy, and overall fertility. PCOS tends to increase insulin resistance and inflammation in the body, and those two factors also put strain on your thyroid. Meanwhile, a sluggish thyroid makes PCOS symptoms worse by slowing down your metabolism, and it also impacts ovulation rates. When both conditions exist, they amplify each other. But when you support the root causes, you can start addressing both conditions simultaneously. Ask your healthcare provider for a full thyroid panel, not just TSH. That means asking for TSH, which is the thyroid stimulating hormone, plus the additional free T4, which is the inactive thyroid hormone, and asking for free T3, which is the metabolically active thyroid hormone. I would also recommend that you ask for the two common antibodies called anti-TPO and anti-thyroglobulin antibodies. And here's the part that most women don't hear until it's too late. Even if your thyroid hormone levels look normal, having high thyroid antibodies can increase your risk of miscarriage. Thyroid antibodies signal that the immune system is attacking your thyroid and that damage has occurred to the thyroid gland. Usually this is due to an autoimmune thyroid condition called Hashimoto's thyroiditis. This inflammatory cascade can contribute to reduced egg quality, it can impair implantation rates, and it can raise miscarriage risk in early pregnancy. In fact, studies show that women with anti-TPO antibodies are more likely to experience pregnancy loss even if TSH is normal. This is why I often say it's better to test and not guess, especially when it comes to your fertility journey. Now, if thyroid antibodies are elevated, don't panic. You can reduce inflammation through diet, stress reduction, supporting gut health, and specific nutrients like adequate levels of selenium and vitamin D. Think of your thyroid like the body's command center. It needs very specific building blocks to work properly. When it comes to thyroid gland health, we often need to prioritize the following nutrients. Selenium, which is a mineral that helps to reduce thyroid antibodies, and it also supports thyroid hormone conversion. And then we have zinc, which is another mineral, and it's vital for ovulation, androgen regulation, egg quality, and overall immune system health. Another important mineral is iodine, and it is essential for hormone production, but I do recommend that you avoid supplementing with it unless you're being supervised and know the correct dosing strategy, as iodine can make thyroid conditions worse in some circumstances. And then there's vitamin D, which is also known as the sunshine vitamin, and it helps regulate the immune system and supports menstrual cycle health. And another important mineral, which is iron, it helps with improving low energy, and it also supports thyroid hormone conversion as well. And last but certainly not least is vitamin B12, which is crucial for energy, methylation, and hormone detoxification pathways. So the moral of the story is, if you're depleted in any of these vitamins or minerals, then both your thyroid and ovaries can't exactly function optimally. And what's great is you can test most of these nutrients through blood work. Or you can start by focusing on nutrient-dense meals and targeted supplements based on your needs and blood work results. And here's something most women don't realize. Your gut health is often a missing piece when it comes to PCOS, Hashimoto's, and overall hormone balance. Think of your gut like the gatekeeper. It decides what gets absorbed, what gets eliminated, and how your immune system reacts. When that gate is damaged, it can lead to nutrient deficiencies, immune flare-ups, and hormone disruption. There are quite a few digestive issues that can contribute to PCOS and thyroid problems, but today I'm just going to dive into a few of them to get started. So microbiome dysbiosis, which is just a fancy term for an imbalance in gut bacteria, is linked to insulin resistance, androgen excess, so excess testosterone, and sluggish thyroid function. When it comes to supporting the bacteria in your digestive tract, the first thing I often recommend is increasing fiber in your diet, as fiber helps to feed the good gut bacteria, and eating more probiotic-rich foods such as kimchi, kombucha, homemade sauerkraut, and fermented foods as well help to replenish the good gut bacteria. And another contributor to poor gut health can be impaired bile flow or issues around stomach acid and digestive enzymes. If we don't have adequate levels of each, then this can block absorption of key nutrients like iron, B12, and zinc, which we already spoke about and which we know is crucial for both thyroid and ovarian health. So by supporting your gut, this helps to reduce inflammation, improves nutrient absorption, and can calm your immune system. It's one of the most powerful but overlooked ways to support both PCOS and thyroid gland function. And in terms of a few action steps to get started, consider implementing the following. Remove gut irritants. So cut back on ultra-processed foods, alcohol, and added sugars and excess caffeine. And then add in gut healing foods like bone broth, ground flax seeds, fermented veggies, or ginger, as long as they're well tolerated. And consider additional digestive support like digestive bitters or digestive enzymes as needed, especially if bloating or constipation is a key symptom that you've been experiencing. And definitely prioritize both sleep and stress regulation because the gut and nervous system are deeply connected. And when you're dealing with both PCOS and thyroid dysfunction, it can feel quite overwhelming. But supporting your health can start with just a few simple steps. And these first steps can look like stabilizing your blood sugar, which means building meals with adequate protein, fiber, and healthy fats. Supporting digestion as your gut influences thyroid antibodies and hormone absorption, and also checking your nutrients, which often focuses on testing your vitamin D, iron, and B12 levels. And if we can focus on reducing chronic stress, that will also help to support thyroid and reproductive hormones. And probably the most important factor is just being consistent. You don't need to be perfect, but consistency is definitely key. And remember, you don't need to tackle everything at once. And supporting your thyroid also supports your cycle. And when both are aligned, your energy, fertility, and mood will improve too. And if this feels like the missing puzzle piece you've been looking for, download the free PCOS Pregnancy Prep Guide that I created. It walks you through the exact nutrition, lab, and lifestyle steps I use with my clients, and it's the perfect place to start if you're feeling overwhelmed or confused. The link is right below this video, or it can be found at metabolicmo.com. See you next time.